Hi everybody, welcome back to the Dr. Sia channel. In today's video, we're going to be talking about how ambivalent attachment makes people believe that they have to take care of other people so they can be taken care of in return. Let's get started. Alright, so ambivalent attachment is an attachment style that a child learns to keep towards their parental figures or caretakers when their parents or their caretakers appear like or seem like they cannot cope with the child's own difficult emotions and pain. What happens then as the child gets, for example, say sad and notices that every time they get sad that their parents, for example, their mom, gets even more sad than they get sad, or that their mom gets really overwhelmed, the child learns that their feelings are actually quite hurtful to their parents. And so what they do with that is they make sure that they instead take care of their parents. So what happens there is that the child then finds themselves in a very peculiar situation where they're going, I thought this was about me right now. I thought I'm meant to be sad right now. But it seems like every time I have these very strong feelings that mom gets even more upset than I do. Now, it seems like mom keeps getting really upset in a lot of situations. So then the child starts perceiving threat. And the threat that happens there for the child is that they start believing, quite accurately so possibly, that if their mom continues to be overwhelmed, that they won't be able to care for the child. So then they learn, okay, there are some things that I can do and I cannot do. I can't cook for myself. I can't put a roof over my own head. I can't go to work and make money. I can't, etc., etc. But my mom can. So who's the person keeping me alive? Well, it's my mom keeping me alive. So what I need to do to stay alive is to take care of my mom, emotionally speaking, so that she's well enough to take care of me in return. And another thing that also happens for the child is that they start learning that they actually can't really take care of themselves. So they're so bogged up with taking care of their mom, taking care of their dad, taking care of whoever's taking care of them, that they don't really develop the ability to take care of themselves. Now, if we look at that as adults, it becomes this sort of reciprocal emotional entanglement that we call sort of co-enmeshment or codependence, where the dependent person will be taking care of everybody else so that they in return will be able to take care of the dependent person. Right? So what does that mean? It means that a person with ambivalent attachment will be taking care of everybody else in hopes of everybody else returning those favors, returning that care back to them. So there really is no real mention here of self-care. And with self-care, I don't mean here painting fingernails or shaving beard or taking a shower or going to the gym or anything like that. I'm talking about this idea we have within ourselves that we really care about ourselves. So that's really what self-care is. Do you care about yourself? Do you care about who you are as a person? Or is your care for you conditional? Sorry, is your care for you conditional somehow? So that's really all we're looking at when we're looking at whether the person can take care of themselves. And with ambivalent attachment, there's this perception that they cannot care for themselves. So they have ideas like they might be dysfunctional somehow or inadequate somehow, or that they're not trustworthy somehow. And then what happens is instead they rely on other people to be their own caretakers. So they're sort of going, well, I don't know what to choose. I don't know what I like. I don't know what I want. How am I meant to know? You tell me instead. You tell me what I'm meant to like, what I'm meant to do, what I'm meant to study, where I'm meant to go, what I'm meant to eat, which movie I'm meant to want to watch tonight when you decide which cinema we go to. So it becomes this really a huge inability to look at oneself, to look at their own selves and take care of themselves. Now this of course becomes exhausting for the person with ambivalent attachment because they're constantly having to look out for people to take care of them, but it also becomes exhausting for the people around them because the people around them also will be exhausted by constantly needing to take care of the person with the ambivalent attachment. So I hope that really clarifies my posts on Instagram on ambivalent attachment makes the child have to take care of their parents so that their parents in return can take care of their child. And I hope that it also clarifies this idea that I've posted again on Instagram on @DrSia about this idea that people with ambivalent attachment really are bogged up with shoulds and what they ought to do's. And really, it's because this idea is there that when you have an ambivalent attachment, you can't really know what you want. And anything else that anyone else tells you that you ought to want or should want or need to want is really still a should, a want, or a should, an ought to, or a need. It's not really a want. So those are two posts that I'm really trying to clarify. And then there comes this idea of what can we then do about it? I get this question a lot of times, but I think that one of the most important things that we need to develop is some sense of insight into this idea. The insight that we are ambivalent is the first place to go. Once you know that you have an ambivalent type attachment, then a lot of doors open for you in terms of what you can be doing about that. And as my listeners would know, my advice is always that therapy is the way to go with that. But there's a lot of information that you can take with you into therapy then. So rather than going to therapy and going, oh yeah, I tend to get anxious, which is obviously what most people will come to therapy and say, it would be something like, I have an ambivalent attachment and I think that relates to my anxiety somehow. I don't know, but I want to do something about it. Now, already there, you're like way ahead in therapy. Already there, your goal is such a productive and meaningful goal, because you know why you get anxious is because you tend to have an ambivalent attachment. So you tend to get anxious in situations where you have to make decisions, where you're in the spotlight, and that spotlight is not about you taking care of other people, but rather it's about your wants, your own desires, your own passions and values. And then that's what's going to make you anxious. So then already you're way ahead in therapy. I hope you enjoyed the video. As per usual, I hope you subscribe. I hope you let your friends know what I'm trying to do on YouTube and what I'm trying to do on Instagram. I'm just trying to share as much information as I can about psychotherapy, about attachment, about defense mechanisms, about ISTDP, and about sort of all these things that really relate to actually feeling better in life and actually having a flourishing, nourishing life, as opposed to, the 3 ways that we can remove our anxiety right now, which does not work. There is no such thing. I'm sorry. There just isn't. If you haven't been told by now that it's good for you to breathe, then, that's not going to happen in these videos. But hey, tell everybody about these. I hope everyone's taking care of yourselves. It's tough times out there. A lot of isolation going on. Now more than ever, we need to be able to feel comfortable relying on getting help in therapy. I am also seeing patients. You can also find all my details, my contact details on Instagram, but I'll also post them down here for you as well. And I know that all my colleagues are also seeing people, seeing patients. People all around the world right now, psychologists, psychiatrists, are opening up themselves to telehealth as well. So if you're interested in any of that, please just go ahead and book in. Don't be afraid to see somebody. It's not, we're just people who know a bunch of stuff about a bunch of stuff and can help out. So that's all there is to that. Thank you. As per usual, I'll see you next time. Bye-bye. I can never find the button.